So this is the topic that we're going to talk is about veins and aesthetic treatment. My name is Idalis Bailey. I have more than 16 years experiences working in this health, wellness, and aesthetic field. I'm a registered nurse with an MBA in marketing. I'm also in skincare specialized, New York State licensed as a medical esthetician. I own the medical spa Renew Aesthetics with more than 16 years experience. I'm the host of Hashtag with Idalis. This is a podcast and interview. And also we have a special bestseller book with 16 professionals that we started last year. And this year is the second year we are working for that group look for as a speaker lead. This is the networking that we are doing every month. What is the idea from our networking is to work together, to say, discover the possibility of collaboration. The idea is to work as a team specialized in this industry, health, wellness, and aesthetics, where we can build a good relationship and then we can collaborate together and grow together and look always the possibility to expand ourselves. We are doing this one virtual because it's more easy. We don't have time for every month, to prepare this. We have 3 years so far so good doing this event. A small business, as a professional with a small business, we participate here, and every month we are inviting new professionals. We always choose a topic, and the same topic is going to be in Spanish and English. The benefits for this networking always is to look the possibility to expand ourselves, our knowledge, learn from the another professional, the new techniques, the new equipment. That's amazing. Today, the way that I found you guys, it was through social media. So now how important is to work in social media, how important, is doing our promotion. So that's why that's passion, the love that we are doing for our career is to put a little bit more effort, and everyone is busy, but it's good to have a position and show our community, our patient, our customer that we always going to work to be the best, especially when we work together as a multidisciplinary in professional health, wellness, and aesthetics. That's why it's good for the new opportunities too. And also it's very important that we can have sequencing. We have to building good content to show the credibility for our audience. So it's very important when we go into the networking that it's a good opportunity, be focused in your industry, in your area, because we always want to expand our customer, our audience. We always want to grow, but if we are not focused to know what is our target, so we can lose our time. Our time is gold. So that's the best opportunity when we only be focused in this kind of audience. Okay, what is the opportunity that we can really building, or we can have this networking as a professional? Job proposal, new opportunities, collaboration. There are a lot of companies now, they are very interested about this. They want to know who are doing specialized, for example, Eddie is doing injectable. So we have Renee working with amazing program that is not really common. It's like he's a pioneer in that kind of practice that he's doing, and he have amazing experience in Austin, Texas. So I think that is a very nice way where you can show your experience, your expertise through this medium, because it takes time, and your time is gold. But also you don't have to pay to go for this event, or you have to start to work just a few minutes and then you can continue doing. But at the same time, you can build more content for your social media. This is a little bit an example statistic that we are doing from 2020 until 2023. We started the first 2 years only in Spanish, and now we are doing in Spanish and English. We have 32 countries participating in this networking, more than 1,700 professional and 100% satisfaction. We never stop. We started from 2020, and thank God, so far so good. We can doing this is more stable. From this networking, we building now the global integral beauty with different way where we have positioned our name and our expertise. What we have to do, just only when the speaker are talking, be quiet, the microphone has to be mute, and the camera has to be on. This is the 22 speaker. This was the way how we started. So this was the few keynote speakers that we invite during this year, and this is the 2023. So you're going to be in this page for the next events, because every month we're going to add the new speaker. This is the statistic how we was growing from the year that we started and right now. This is that we are doing now through Global Integral Beauty. We have a book. Now we are working for the second edition of the book. It's going to be launched, this book, on this conference on November 11. That was the video that I showed you. We also have a magazine that we like that you share your article. We can publish your article here. This is a special magazine just only for health, wellness, and aesthetics. This is the networking that we are doing every month. This is the real networking, and also this is the award recognition that we are doing for the first time this year. So again, the rule is again be with the microphones in mute and the camera on. That's the most important. Let's go to talk directly to the varicose vein treatment. I was discussing with the doctor yesterday in Spanish too. It was a live that we have a conversation. Today is very important. We have to, as a professional in health, wellness, and aesthetic, we have to focus in integral beauty, not only external beauty. So that's the goal for ourselves. When we work together, we only thinking about the external area. So when our patient coming for our business, they want to know. If we are talking about the vein treatment, it's not only to remove the vein because they don't looks not good for our clothes or our image. Is the most important is how they work inside, how we can take care about this, what we can do to be better or prevent in case they are started, or how we can take care when we already have the vein out. So that's why we have expertise today that we can ask them, and they can share their experience according to their practice or their discipline. Today, there is the famous treatment for this kind of problem that they are of. Right now, the statistic is very high in all our practice. We can offer today the laser treatment, we can do the phlebotomy, we can do radiofrequency treatment, sclerotherapy, but also prevention. That's very important. So we can discuss with the expertise that we're going to do as a panel, a couple questions, and each one is going to discuss their experience. But also I would like to know exactly what you're doing, where you are located, why you do that, what is your experience, because I want to show to this community, global community, if you have the experience, if they are here, if they are listening to us, they can visit you, they can call you, and you can advise them, or also you can do the treatment for them.
We all know that alcohol and smoking is one of those big ones for most people, right? In this society. So that's also why big on the intake form, I'm always asking my patients, do you drink? How much do you drink? Smoke? That affects all of the vascular system, stress, obviously, and sometimes hormone regulation as well can be problematic for the vascular system. But big time, I think like the most common thing that I see, and I usually try to like dive into that's not familial, like or like passed down genetics issues, is just smoking and drinking.
Thank you, Eddie. Now we're going to continue. Susan, the question is, it's the same question because the first one is everyone the same. So I'm going to repeat for you, Susan. The question is, from your area of expertise, what kind of medical and lifestyle factor negatively affect the physical, sexual, and aesthetics health of the vascular system?
So I have a lot of patients that come to me with varicose veins and a lot of thread veins. So one of the things I ask is, what is your job? Do you stand a lot? Do you have a lot of standing every day? Because basically how I explain it to my patients as well is that your venous flow is supposed to go back upwards, but it has little valves that literally block the backflow. And with weakness, with a lot of pressure coming on from gravity, if you stand a lot, you are weakening those little valves and eventually they give in and you end up with what is called varicose veins. Another factor obviously is the lifestyle. One of the things that I do tell them is that, you know, the minute you have a chance, please lift your legs up, lift them up, cool them down. You need to not just simply stand. If it has anything to do with thread veins, spider veins, especially face or body, if they are in different temperatures and different altitudes, so my airline crew have a lot of broken veins, capillaries, thread veins. It has to do with pressure dilation and constriction of the venous flow and the capillaries. And then they obviously, you know, have very weak venous walls, and that will again, when it gets dilated and constricted, will allow blood flow through those porous little veins. So if it has to, if they are extreme sports people, they will end up with a lot of broken capillaries, thread veins, spider veins, and so that's what from my expertise or in my field that I'm able to diagnose is what I ask them first.
Thank you, Susan. I really appreciate that information because we never pay attention. We are doing every single day the routine, but now that you are talking about that, we realize that's why it's very important to participate, because we always learn a little bit from each professional, and I really appreciate your experience. We're going to continue with Renee. Renee, the same question. From your area of expertise, what kind of medical and lifestyle factor negatively affect the physical, sexual, and aesthetic health of the vascular system?
Two panelists, Susan and Eric, answer already what the most common is, right? Right now, especially right now with all the computers, all the technology, we are not moved enough. We're always sitting, or a lot of people there, we're not really physical. And that's part of the main thing, right? So if we not work out during the day, or we're very in the computer or whatever we're doing, so that's part of the problem. The diet that he said, right? How much we drink, how much alcohol is in our system, smoking. Susan said it, right? A lot of people are standing, so it doesn't help a lot. Those things, again, I think the answer is, they already give you the answer, and for me as well, is we need to be more, the people right now, we're not work out enough, you know, we're very steady, we don't do a lot of things that we're supposed to do to be better, health-wise.
Thank you, Renee. Eric, how sclerotherapy works? And what are its limitations when you are treating veins? How to determine what is more effective between sclerotherapy and laser?
What I have found, so we use primarily polydolcinol injections to treat these varicose veins or little veins or spider veins, and to me, it has to do with the in conjunction, right? So some of these veins are too light to treat with a laser, and they're too big to treat with what I have to do. So you have to take that patient into a hole and say, like, this may not just be injections if you really want 100%, right, of a treatment. So, when we inject polidocanol, it goes in and it basically creates inflammation throughout the vessel wall, and that creates the vessel to collapse on itself and then lose its blood flow. And in essence, it just breaks down and gets uptaken by the body. And honestly, quite literally, these veins and vessels will come back over time for most patients. And you don't want to treat very big ones in the office. Like I'm in a facial plastic office, I don't want to treat one that's going to give my patient a DVT and a whole bunch of other things. So we have to take into consideration what type of veins we're treating. However, the injections are great. They are, they can be quite painful. They do have some downtime. There is some bruising associated. So I also take into consideration, what does the patient want as a downtime? What is their expectation about when they're going to be able to be out in the sun or do these things? So taking all those things into consideration, honestly, combination therapy is the best. And I'm sure others might even say, like, I even tell patients to take internal arnica and external arnica on the veins prior and after, because you can actually lighten some of those veins just with supplementation. So overall, using a combined approach, it's never just one thing for me. As long, I would like the best result at 100%. So we try to figure out which way to go that gives that 100%. Lasers won't always get some of those bigger veins or as well, and also it's quite painful. So we just kind of go through an algorithm to make sure that we get that 100%, but also let the patients know that isn't just one thing. Sometimes we need to do multiple levels of treatment.
How sclerotherapy and mesotherapy can work together to improve varicose veins? And what are the benefits of the cryotherapy and infrared light therapy?
Well, like Eric said, right, this is all this complementary, right? So I work with Shaydal, my wife, she does cryotherapy as well. And we provide the cryotherapy chamber that goes to 100 below Fahrenheit for 2 minutes, and then they help with the circulation, help with metabolism. So all the injections that you guys do, so help to reduce the inflammation, and again, the circulation will go faster. And with the red light therapy, it's it's the sun that we have here. It's basically what it is, vitamin D for you. And again, the circulation is hand to hand circulation to your body. Your metabolism regenerates the cells, the mitochondria that we have. So we are so that's why we incorporate the sclerotherapy that Cheryl does with all the therapies that we do have here. So the cryotherapy, the red light therapy, and as well the compression boots that we have for the patients.
Thank you, Rene. What aftercare therapy an aesthetic specialist can offer after the invasive vein surgery for patient recovery quickly and safe?
So when I send patients to vascular surgeons for sclerotherapy or the pulling of the vein, because they come to me and they've got small little angry thread veins or spider veins, and then they say, but can you remove them? Yes, we probably can. With the plasma pen works amazing, because the heat that it exerts onto that capillary it's mind-blowing. It really, really is good. But there is downtime, and unless they pull the feeder vein, those veins come back, even if they have been. So one of the things, if it is facial, in the face or décolleté area, we always also recommend the vitamin K serum, because vitamin K strengthens capillary walls and is vasoconstricting. So that means it prevents any further capillaries from breaking or dilating. If it is on the body, obviously we do recommend that they use Venavine or some other internal supplement that will help strengthen the capillary walls and the venous walls. And obviously a lot of sports, cooling down, not they basically have to try and stop doing what they were doing that caused it in the first place, unless it is hereditary. And that means if you are a person that has a lot of walking to do or standing to do, you have to sort of, pick your legs up, cool them down. We give, in actual fact, a lot of arnica. We give a lot of aloe vera, which is very cooling, very calming and hydrating. And then, yes, they just have to change their lifestyle. That's basically where we come in, and we work with their lifestyle with them. And we also tell them it's ongoing. The fact that you had a vein pull doesn't mean that you aren't going to get other veins coming back or getting other varicose veins, unless your lifestyle changes. We can manage it.
Thank you, Susan. Everything that you're talking about is really good.